So I am Amy Dahlman, and I'm with Dancing Sky Area Agency on Aging. And we are one of 7 area agencies on aging in the state of Minnesota. We cover 21 counties in Northwest and West Central Minnesota. And I actually work out of my home in Detroit Lakes. And we do all kinds of services to help older adults age well in their home. But if I spent the entire time talking about our services, we'd never get to Sue. So I will just say that 2 of our big services, one is the senior linkage line, and that's a toll-free statewide number that anyone can call for assistance. And I will put that in the chat as well. And then I also want to just mention that we do outreach education on a variety of topics. And when we are not the expert, then we pull in people like Sue to talk on a specific topic. But know that we're available for presentations, or we can help you find a speaker if you're looking for one. And also we have these educational webinars at least once a month, sometimes even more often. So watch our Dancing Sky Facebook page. They come up on there. And we just really want to make sure that people are informed and aware of things as they age. And on that note, I'm going to turn it over to Sue. Sue Sorensen is with Hospice of the Red River Valley. And I will let her take it away and kind of, Sue, if you want to just kind of tell them how you want questions to come up.
Perfect.
I can watch the chat and let you know if there's a question in the chat.
I think, is Karen on? I don't see her name. Okay, Karen was going to put, it doesn't matter. We will have, or Amy, can you put our phone number in the chat?
Absolutely.
Hospice of the, and do you want me to give it to you?
Sure.
Okay, it's 1-800-237-4629. And our website is www.hrrv.org. And I would say at any time, if you have questions, just pop in, or if you are more comfortable putting them in the chat, you can do that too. And I'm sure Amy will let me know if there is a question in chat, but feel free at any time, because if you're anything like me, if I don't ask right away, I forget what my question was. So thanks so much for joining today. Like Amy said, I'm Sue Sorensen from Hospice of the Red River Valley. My title is Community Relations Specialist, which I'm still trying to figure that out, what that actually means. It kind of changes daily, and that's one reason I love what I'm doing. So I never know what my days look like. And Joan Bings also has joined today. Joan is community relations for she works out of our Grand Forks office. So Joan, you pop in at any time too and help me out if I'm stumbling. Okay, so our service area covers over 40 counties in North Dakota and Minnesota. Again, if you go to our website that Amy has in the chat box, we have a service area map along with a lot of great information. So feel free to visit that at any time. So again, if you have any questions, make sure you ask immediately. So one thing we're going to talk about today are myths of hospice. And I've been with Hospice of the Red River Valley for about 6 years. Prior to coming to hospice, I was a nursing home social worker for about 30 years. I had several things I thought were correct about hospice until I joined the hospice team. And, I was not correct on a lot of things that I thought. And when I'm out speaking to different groups, it still amazes me some of the questions people ask. So I think education is just so important, getting out there, sharing what hospice is all about. So one thing I want you to do is picture in your mind someone that would be on hospice. What do they look like? What are they eating? Are they communicating? So picture that person in your mind. is there anyone that's willing to share what that person looks like? Anybody out there? Usually when I speak to groups, what they say is they picture someone in bed, not really eating anymore, not really communicating. Maybe they have a day or two left of life.
Sue, somebody put in chat, like my grandparents.
Yes, okay. Thank you. And so one thing when I'm out again, talking to groups, I was talking to a group not that long ago. And when I ask that question, most people say they're in bed, not eating, not drinking. They're, you know what? And what that person put in their chat box, that also is great, because a lot of people think hospice is just for older people. Unfortunately, we have babies that are on hospice, young people on hospice too. So thank you for your comment. So if there's nothing else you leave with today, please leave with a different mindset of what someone on hospice looks like. Because when like one of these groups I was talking to not long ago, a gentleman raised his hand and he said, I'm currently on hospice. And there were about 15 of us around the table. And I hate to say it, but I actually was a little surprised too. I mean, looking at him, he didn't look like anything was wrong with him. And then he had to leave because his hospice nurse was coming to see him. So be more open to that vision of someone that's currently getting services under hospice. Okay, so another myth I often hear, people think hospice is just for cancer patients. And that is not correct. About half the people we see have a diagnosis of cancer. Otherwise, we see a lot of people with COPD, ALS, Parkinson's disease, dementia, and several other diagnoses. And like I said, that's so common for people to think it's just for people with cancer, but that is not correct. Okay, another myth that I often hear people say is, well, it really doesn't matter what hospice agency I go with because they're all the same. I like to explain that like grocery stores. Okay, so if we want to get, some milk, bread, we can go to any grocery store and get those, few items. But there are certain items that only certain grocery stores are going to have. So it really is important. If you have someone that's going on hospice, check around, ask questions, ask people that have received services from that agency and see what they say. So some of the things that make us different, we actually have 5 providers that work for us full-time on our staff. That is really unheard of. We are very, very fortunate that they work directly for us full-time. We do admissions 24 hours a day, 7 days a week, which isn't real common. We offer grief support to anyone in our service area, not just people that have been on our services. We offer many grief classes. We offer one-to-one support and community support. And all of those things also you can find on our website. And again, they're all free. A lot of them are virtual and they're open to anyone. Often, let's say a nursing home has had a lot of deaths of residents and they're having a difficult time. Our grief specialist can go in and talk to the staff. Or let's say there was something that happened to one of the high schools in town and the students are having a difficult time. Our grief specialist is available to go to the school to talk to the students and the teachers. Another thing is we offer classes, free classes for for all staff, but we offer CEs to nurses and social workers, and we come to you. And again, those are free, and they're for all staff. We do lunch and learns for social workers and offer CEUs. Those are once a month and they're virtual. And again, that information is on our website. Also, through Hospice of the Red River Valley, you can call our nurses 24 hours a day, 7 days a week. And if they're not able to, answer your questions over the phone, they will make a visit too. We have several volunteers that volunteer for Hospice of the Red River Valley, and we certainly appreciate that. Okay, so that's another myth, that all hospices are the same. Now, another one is hospices for the last few days of life. Again, and we kind of covered that already, but I hear that constantly is, well, you know what? My parent isn't ready for hospice. They're still going to church. They're still getting around. It's so important. Number one, I always tell people, don't wait until the very last days. If you have a parent or have someone that has been in and out of the hospital more, has had an increase in care they've needed, has had infections, and you can see a change in them, call hospice and ask for a referral. And a nurse will come out, visit with you, let you know if your hospice appropriate at the time, or if you just want information to know, what's available through hospice and understand it right. Because like we all know, there's so many myths on hospice. And there's no charge. All you have to do is call our 800 number and ask for a referral. Another one is you can only be on hospice for 6 months or less.
It's all the myths about hospice.
And that too is not correct. We have people that are on hospice for 1, 2, 3 years. In order to qualify for hospice, that is correct. You have to have a prognosis of 6 months or less if the disease runs its normal course. Well, obviously, no one knows that for sure. So we do have people that are on, like I said, 1, 2, 3 years. We also have people that graduate off hospice. So sometimes people get on hospice and they actually do better and they may no longer qualify. So they may be on for 6 months and then we end up taking them off because they no longer meet criteria.
That's a nice
I've had
thing.
this nursing home, we had this one guy who was on it 3 times. But every time we put him on a hospice, he got so many more visits. All of a sudden he wasn't depressed. He started
Yeah, and that is another thing that people don't realize, that we do have people that graduate. Believe it or not, people are often sad when they graduate because they know they're not going to get all those additional services. So, okay, another big myth is people think when they go on hospice that someone will be with them 24 hours a day, 7 days a week. And we always really stress that at the time of referral. And if people are going to miss a piece of information we give them, it's going to be that. They start to they assume that once they go on hospice, there will be a staff person that is there 24 hours a day. That is not the case. They have someone that's available by phone 24 hours a day, but not necessarily someone with them 24 hours a day. Another thing I often hear is, well, if I go on hospice, I can never see my primary provider. That again is not correct. People can see their primary provider if they choose to. We just want them to let us know that they're going in, because we want to be sure that their primary provider realizes they're on hospice. Again, when you're on hospice, it's for comfort. It's not for aggressive treatment. And I see Karen there. Welcome.
And
So
Sue,
Karen, yep.
Sue, I just wanted to mention, we have a comment in the chat. And the comment is, it was surprising to me that advanced dementia can qualify for hospice too.
Yes. I think that's surprising for a lot of people. That is one diagnosis that is harder to get someone to qualify under, but we can. So thank you for asking that. Another thing is sometimes people think when you go on hospice, that means you'll have a nurse and a social worker that comes to visit you. And yes, that is two of the disciplines that come, but there's also the whole team is made up of nurses, social workers, CNAs, chaplains, volunteers, and a grief specialist. Do you have to have all those people come and see you? No, you don't. Let's say when you first go on hospice, you're doing quite well and you only want a nurse to come, and that's fine. That nurse has to come at least every 2 weeks. We like our nurses to see the patients every week, but if someone doesn't want that, we're fine with seeing them once every 2 weeks. And again, maybe someone just wants a nurse and a social worker to come to begin with. That's fine too. Whatever that patient wants, we will work with them. Any questions so far?
I don't see anything else in the chat so far. I do have a question though, Sue.
Sure.
So I know that the doctor has to order, there has to be a doctor's order. What if, sometimes I feel like doctors are maybe reluctant to take that step because I think they feel like they're giving up hope. And I think they don't want the patient and they don't want the family to think, oh, I'm giving up. So what if the family is interested in that step, but the doctor doesn't seem like they're talking about it, they're not recommending it? Is that an instance where they could reach out to you and you could kind of help with that process?
Exactly. Thank you. And you know what, Amy, I don't have that as one of my myths. And so a myth is that a doctor is the only one that can make the referral. Anyone can make a referral. So if a family member or if a patient has questions, yeah, they can reach out. All they have to do is call our 800 number. In order for someone to go on our services, yes, we need an order from their provider, along with our provider. You know, another thing that sometimes I'll hear is, you know, from providers is, you know, I don't know if my patient has 6 months or less, and none of us do. And our medical director, she's kind of the expert in that area. So if someone's not sure, you know, make that referral. And our medical director will say, no, you know, we can't find a diagnosis to get this person on at the time, but, you know, watch for changes and call us again. Another thing, I think a lot of times people think, well, if I need hospice, my provider is going to tell me that. And I can tell you, I talk to a lot of providers, and a lot of providers tell me they're not comfortable bringing it up because of exactly what Amy said. They don't want their patient to think they're giving up on them. And I look at quality of life. They're not giving up. They're just voicing how they want to live those last days, months, years. So it's such a benefit to not only the patient, but to the family for the support. Another thing I've heard people say is, you know what, I don't have any pain, so I don't need, you know, hospice because my pain is being managed. There's so much more to it than just pain. You know, it's symptom management. That's one piece of the puzzle. The spiritual needs, the emotional needs of the patient, and also the needs of the family. Sometimes the patient may be okay with dying and they may be ready, but their family's not. And there's so much education that goes along with hospice. Another thing that people will often say as well, at the time of death and everything, I no longer get any services from hospice. Is that correct? That too is not correct. We have a grief specialist that will be in contact with that family for the next 13 months. If they tell us they don't want any contact, then obviously she won't. But otherwise, she will be available to that family for 13 months. And what we find too, sometimes, like for the first 3-4 months, people say, no, I'm fine. I'm fine. And then maybe at that 4th, 5th, 6th month, all of a sudden it's hitting and they think, what, I do need some help. So I think that's a wonderful service that we offer too, and all the different classes that we offer for grief support also. And then if I go off hospice, sometimes people think if I go off, I can never go back on. That is not the case. If you go off, let's say all of a sudden you decide you want aggressive treatment, you go off our services, and then maybe 3 months later, you decide, you know what, I guess that's not the route I want to take. I want to go back on hospice. Again, if you qualify, we would pick you up. It's not like you have to stay off for so many months or anything. And again, like I said earlier, our support groups are open to anyone, and there's no charge for those support groups. Any questions that you may have so far?
I don't see anything in the chat.
Okay. Hospice is such a wonderful service for people. Oh, there is there one.
All right, it says, my mother passed from Alzheimer's disease a few years ago. We involved Hospice of the Red River Valley the last 6 months of her life. They were a literal godsend to our family and made such a difference in our peace of mind. Thank you.
Oh, thank you. Yes, I think, so is she comfortable with saying if the family got as much support as the patient received during those times?
She said, yes, they called us often before and after her death.
Yes, great. Anything else? Any other questions? Any comments? Anything that people were surprised about today? Any of the myths?
One thing I'm wondering about, Sue, is do you have any data on how long the average time that people are on hospice? Because I know, individuals, it's 6 months or less, but I think people often wait far too long. And I heard the number before, but I can't remember what it was.
Last statistic I saw with us was 28% are on for 7 days or less, which is so heartbreaking to me. Yeah.
All right, I think we have another one.
Okay.
In the chat here. It says, I have a client with advanced liver disease related to alcoholism. She also has degenerative spine disease. She is always in pain, but because of her substance abuse history, she isn't getting sufficient pain management. Would hospice ease her misery?
Hospice may look at pain management with her. So I would say it's definitely worth a call to have an assessment done. Thanks for asking. Okay, if I would not be doing my job if I did not bring up the importance of advanced care planning and advanced directives. I have very, very strong feelings about advanced care planning. So I'm just going to ask some questions and, so often people, when I bring up advanced directives, they'll say, well, they may be 50 years old, but they're saying, yeah, I know my parents should really write an advanced directive. I've talked to them. They keep putting it off. And that's true. Really, your parents should have one, but you should have one too. And I think that's another thing that we just think that's for older people. I have had people tell me the best gift their parent has ever given them is to have an advanced directive and to have had those discussions with them prior to an emergency. So I'm just going to ask you a couple questions. Usually I say, raise your hand, but since I can't see you, I'll just ask these. So you think about this individually for yourself. Okay. First of all, I would say raise your hand if you do have an advanced directive. Okay, so if you have the advanced directive, raise your hand. Oh, good. Thank you for putting your camera on, Pam. Okay, now for those of you that did raise your hand. Okay, sorry about that. Raise your hand if you discussed your wishes with the person you named as your proxy. Oh, Pam and Amy, both you guys are doing good.
And
Okay, so now,
I don't know if you can see it, but John is also raising his little hand on his virtually as well too.
oh yeah, now I see it.
Yep.
Yes. Awesome. Okay, you guys are doing great. So important. You have a healthcare directive. You've talked to the person you named as your proxy so often. Well, I'll save that for a few minutes from now. Raise your hand if you discussed your advanced directive with other family members besides whoever you named as your proxy. Oh, you guys are good, good, good. Now, where'd John go? He disappeared for me. Did he leave because he no longer, oh no, I see him there, but I don't see his little hand. So maybe he hasn't discussed it with other family members. Okay, raise your hand if you gave the clinic or the hospital a copy of your advanced directive. Oh man. Oh, and John's got his hand up. That's good. All right.
And Nicole joined in too.
Oh,
Thumbs up.
perfect. Oh,
And
perfect.
another
There's a few
one. Yeah.
more.
We see thumbs going up. Yay.
Yes. I am so impressed, you guys. Raise your hand if you've reviewed your directive in the last year. I know I'm going to lose some of you on this one. Not Pam, though, not Amy. They're still there. Pam
Well, I
Smith
kind of
is still
cheated
there.
because I just did mine this year. So
Oh, how about Pam? Did you cheat? No, see, okay. So now you just have to continue to look at it each year. So you guys really need to pat yourself on the back because not only do you have it, you review it, you have discussed it. So often people would, oh, do you know where they're at? Does your proxy have a copy of your directive? Okay, good. So Pam, can I put you on the spot?
Yes.
So is there any particular reason why you've done all of this?
We have a nonprofit group in town called Written Gift. And you meet with them for about an hour. They help you write it all up. They print copies of everything. If you don't have the time or inclination, they will make sure that the people that need copies get copies, the clinic, the hospital, etc. And then I mailed a copy to each of the kids. And we have one in our safe, one in our car, one in our camper.
You are doing everything you're supposed to be doing. So when
And
I looked at,
Pamela, I was just gonna mention the written gift, that's out of Alexandria.
oh, I was wondering where that,
I believe
Yes.
that's correct, right?
Yep, I work with Elder Network in Alexandria, Minnesota.
okay. Boy, what a wonderful thing to offer to the community.
It is.
Yeah.
And Sue, there's another comment in the chat too. She said, my family involved hospice initially because we questioned if my mother was getting enough attention in the nursing home once she became non-communicative. Having those additional eyes and ears allowed us to relax just a bit on a daily basis. Some of the nurses were a little resentful that we did not trust them, but in all honesty, we did have questions, so we had to advocate on behalf of our mom. And
Thank you for sharing that.
And then I'm just going to add, Karen has been dropping some resources in the chat as well. Karen Wolfcool is with hospice as well.
Perfect. Thank you. I'm glad you brought that up, nursing homes and assisted livings, because again, people will say, if I'm in a nursing home, why would I need hospice? I always say hospice is like the cherry on top. You have a nursing home staff that is doing their best. But let's say I'm a patient in the nursing home. I'm used to having a shower every day. Nursing homes no way have the staff to give patients or residents a shower every day. When hospice comes in, they can do those additional showers or whirlpools, or if someone wants to have their nails done, or leg massage, arm massage, if someone wants someone to sit by them and just visit with them, we can do those extra things. And again, our providers are experts on symptom management. And so we're there to help with the symptoms also. Who wouldn't want an extra CNA coming in to help them? Who wouldn't want another extra nurse checking in on them? You know, it's a win-win. So thanks for bringing that up. I meant to mention nursing homes and assisted livings. Another thing, payment for hospice. It's a Medicare benefit. Also, medical assistance covers hospice, and a lot of private insurances cover hospice. Again, for those of you that have a healthcare directive, that is wonderful. And I really encourage all of you to do that. You know, if we wait until we're in a situation and we have to make decisions immediately, I would think that would be so much harder. Another thing I was going to mention is when I was working in the nursing home, I'd ask people at the time of admission if they had any type of an advance directive. So often they would say yes. And I'd say, you know, can I get a copy of it? And they'd say, well, it's in my safe box and I don't know how I would get a copy. So like Pamela said, you want copies all over. You want your proxy to have a copy. You want your kids to have copies, the clinic, the hospital, you want copies. At home, you want copies in your car. So you can never have too many copies out there. Another thing they would often say is, you know, I think the person that I have listed as my proxy, you know what, I think that was, you know, my husband and he's no longer living. You know, they don't look at that every year and they kind of forget. And then sometimes they'll say, well, you know, yeah, I guess it's been about 10 years. Here it says I want CPR, but I don't want CPR. So it's just so important to be reviewing that healthcare directive. Another thing, it's so important to not only ask whoever you're going to name as your proxy, have that conversation with them before you actually name them. Because let's say you have 2 kids, one of your kids could make those hard decisions for you. The other one is a softie and you know there's no way they could. You want to make sure that the person you name is able to make some of those hard decisions if they have to down the line. The other thing is, I think it's a great idea to not only talk to the proxy, let's say that's one of your kids, but to talk to all your kids so they're not questioning your proxy. When you're not able to voice what you want, you're just looking at, they're looking at a piece of paper. And maybe one of your kids, if they've never had that conversation with you, they're thinking, I don't think that's what mom meant. I think she would want more than that. Well, that poor proxy, that's a lot of pressure for them to have to say, no, this is what, mom and I had this discussion many, many times. So just have that discussion with all of your loved ones. So it's not just on that proxy or the agent that you have named. And
So we have a couple questions.
Okay.
One is there a limit to what Medicare will pay, either in dollar terms or time limits?
No, as long as you qualify, you meet the guidelines, there is no limit.
All right, and this next question is, do you see many doctors doing pulse?
You know what? Yes, more and more we do. Often that's done in the nursing homes, probably more. We don't use the pulse ourselves at Hospice of the Red River Valley. We'll go by one if someone has one, but that is not the form we use. Right, Karen?
Right. Can you guys hear me okay?
Yep.
Oh, good. Thank you so much for your patience here at the beginning. I was having a little trouble getting in, and thank you so much for letting me jump in. The one thing I wanted to add really quickly about the Medicare question, I think just it's important as well to know. So families, if they're going to the nursing home, sometimes there's a little parameter around that, of course. There are skilled benefits at the nursing home. And if someone is using their skilled benefits, then you have to have that discussion with the nursing home team. If they're coming from the hospital and maybe having a chance to use skilled care, then there's some differences there with coverage with hospice or room and board or whatever that looks like. So you're definitely going to want to have a good conversation with the admission team at the nursing home, just to find out what those benefits look like. Sometimes patients leave the hospital and they may use 5 to 7 days of, if they're eligible, those Medicare skilled benefits and then transition to a hospice benefit. Kind of confusing, and yet lean in on that team that's at the nursing home or that facility to help guide you with those things. Those are good questions, but people do want to use their Medicare resources. I mean, that's something they're interested in doing. Hospice care does not cover the room and board at a nursing home. So if you're a private pay patient, hospice care is not going to take care of that X number of dollars per day it takes to stay there. I think that's something that people need to know about as well. People want to know about that. Yeah.
Yes. Thank you for bringing that up. Do you want to talk about the benefits to veterans in nursing homes that have VA contracts?
Absolutely. So nursing homes that do have a VA contract, a veteran that is service connected upon admission to a nursing home will have coverage in the facility, right, Sue?
I always say there's a good chance of it, yes. Working with the veterans, I would never say always.
Yeah, that's a good point. Never say always is right. I have 2 computers here, so I'm looking at the screen here. My camera's sitting right here. I'm trying to be really mindful of that, but certain facilities within our area have contracts with the veterans. So for example, that would also be a really good question for the nursing home that you're looking at. Do you have a VA contract, especially if your loved one and or your person that from your caseload that you're assisting, you're going to want to know who those contracted facilities are. In our area, Battle Lake Good Sam is a contracted facility, as well as we have a veterans home right here in our community in Fergus Falls. But Sue, you can lean in on some of the other facilities in our region.
Perham, Ecumen, Oak Crossing. Yeah, there's several in the area. We're very fortunate to have so many in the area, Monoman. But again, that's a great benefit for veterans. If they're a veteran if they're in a nursing home that has a VA contract, and they're on hospice, there is a possibility that their room is going to be covered. So thank you, Karen. Those were great points that you brought up.
Have we addressed, is this Lane Magnuson here? Make sure to have the conversation and a copy of the directive to the person who's assigned to follow through with that. So she writes, as a nurse, of course, her siblings have put her in this really important space, and yet it doesn't sound always like they're sharing some of the parameters around that. I think all of us, when we're leading and supporting families and or the caseloads or the people that we're assisting and educating and serving, those are always great questions. I always remember to ask, have you had this conversation with your agent, or what sort of details have you shared? So don't assume, I guess, that has happened, because it's interesting. I come from a family of I have a large family, and two of us are healthcare social workers, and it's interesting that even in that parameter, so to Lane's credit, I've asked, and my mother's a nurse, a retired nurse, and I said, can you talk to us about that? And one time she said to me, well, you'll know, we'll talk about it when it's time. I thought, oh my gosh, this is an interesting turn of events. So great point, Lane, and just a great reminder for all of us to continue to help support that conversation and normalize those conversations as well.
A great gift.
Any other questions or any other comments?
I would like to ask if there's been a time when you have done an assessment or implemented hospice services and the client really didn't know they were on hospice.
Great question. Our policy is we let the patient know they're on hospice. Yes, there are times where families say, you know what, they don't want to know they're on hospice. Well, you know what, we have to. It's not like every time we would go, we would have to bring it up over and over and over. But yes, we would tell them that they are on hospice when they're admitted. Did that answer your question?
Unfortunately, yes.
Yeah.
Dad has moderate cognitive losses, limited mobility, and he's dependent for most of his ADLs, which my mother does. And I've talked with his practitioner, and we think he would qualify for hospice. But he does know the word hospice, and it has that negative thing. He's been receptive to home health nurses and aides and whatnot, but if he heard hospice, he'd boing. So we were thinking, well, maybe we could just pose it as another home health team that's coming in. But I see where you're coming from. It's your due diligence too.
Right. But you know what? I still think you should call a referral in and just let, when the referral is called in, let the nurse know that is a concern. And, they really do a nice job, and they can explain it in depth to your dad. So maybe he understands it better. But I would not keep that from you calling in a referral for him.
Okay.
But just make sure you explain that, to the hospice staff before they come and do the referral.
Yeah, I think if they could just minimize that one word.
Yes. Yeah, no, and I agree, because a lot of people will say too, well, if they think they're on hospice, they're going to give up. But once they understand it better and they don't focus on that hospice word, And they know that people on hospice can be on for longer periods of time. Because once again, you know, a lot of people think hospice is just for those last few days of life. But I think I think a nurse could do a really good job of explaining it and talking more about the benefits of it rather than the word hospice. Karen, anything you want to add to that?
I do. I was just thinking about that. I think that we can approach these things in a couple different ways. I remember how many times when you've worked, like, for example, in a nursing home, or if you've helped people make that transition and then the family is saying, just don't tell mom or dad they're going to a nursing home. We can't use the word nursing home. I think our goal and mission, not only to provide education to our communities and to those that would use hospice, would also be to reassure the family that we recognize, if hospice, that word is a scary word, that we are doing our best to not hurry up and try to help this patient and or family really adjust to the fact that there is a terminal diagnosis and death pending, but more so that we embrace exactly where that family is at, meet them where they're at, meet that patient where they're at, and just work with them, focusing on those positive and quality type of measures. So some people will respond to that, but I also think that nursing staff, I mean, they're very articulate and capable of reading a situation and then paying close attention to how maybe this client is really struggling with that, and they use their expertise to care for them in ways that are going to meet them where they're at, and not trying so hard to school them on what hospice is and how it works, but to really hone in on what needs they have. And every case is different. And so I think that's the gift in doing hospice care, is just to recognize that every home, every plan is different.
And
Perfect.
Pamela, that's pretty common. You know, that gets brought up regularly. So it's not the first time we've heard that. The other thing I wanted to ask you, so you said your dad, you think, would be hospice appropriate, and your mother is still living. Okay,
Yes.
the other thing I think is important for your dad, you know what? If he doesn't think, you know, he's appropriate, there's also such a huge benefit for your mom,
Oh,
you know, all the additional support. And so sometimes when you focus on, you know, the benefits to mom will be so great, not only today, but in the future, then they're more open. And I don't know if your dad's someone that worries about your mom and how she's doing. And
she's
Yeah.
done so for him for so many years, he doesn't even realize if she was missing, he would crumble.
Yeah.
But he's just so used to her nurturing him.
Yes. Anything else? Oh, somebody has their hand up, right?
I don't think so.
Oh, no, maybe I just,
Well, in lieu of somebody else's hand, I'll throw this in there too. He has issues with constipation constantly. He's incontinent of urine and goes through a lot of product. And he should have assistance with a shower to be safe. He's got pain management issues as well. And so I would like to look at it in those terms, like we're bringing in this team to work on those issues. And
yeah. And to help with payment? I mean, because if he was
Yeah.
on hospice, yeah. That's very good idea.
thank you.
And with some of his medications, And then if he needs a walker, commode, you know, a hospital bed, any of those things down the line. Yeah, those are all part of, you know, the hospice benefit.
I'm gonna proceed.
All right, good luck. You'll have to let us know how it goes.
Any other questions? I'm not seeing anything else in the chat. All right, well, if there's no other questions, I just want to thank Sue and Karen for leading this discussion and talking about the myths, because like you said, Sue, there's a lot of myths out there, and the only way we're going to clear them up is if we talk about them. So I just want to say that there's some thanks, some great information, thanks comments in the chat, but please watch our Facebook page for Dancing Sky. We have additional webinars coming up, and we love to partner with Hospice of the Red River Valley and other organizations to bring you information.
And thanks for joining. It was our pleasure. So have a great day.